and for the people that are viewing right now, you are, and I'm not going to steal your thunder, but I'm just going to, a quick one, man. So you are Chief Executive Officer. I'm going to start there. Politician, civil rights advocate. You were the 2-term mayor of New Orleans, the first Black mayor of New Orleans, I might ask.
My
Louisiana
father was.
State.
I was a third, yeah. Mm-hmm.
Third. Louisiana State Senate and Legislative Rookie of the Year. And now president and CEO of the nation's largest historic civil rights and urban advocacy organization, the National Urban League. Brother, thank you for spending your time with us today.
Thank you for having me, man. And let me just say good afternoon to those who are in the East
Yes.
and in the Central Time Zone, and those who are in the Mountain in the West. Good morning. And if you're anywhere else in the world, what's up?
That's what's up, man. So can we start by, can you tell us a little bit about how you started your career and how you got to where you are today?
You know, I've always been a person, I guess, a little bit of an activist and also someone who was motivated to fight against injustice. And, you know, part of it is where I grew up and when I grew up. I grew up in the South in New Orleans in the 60s and in the 70s. And I grew up in a family, my parents, my mother and father were at the front lines of the civil rights movement. My father was a lawyer, an activist. My mother was an activist and a school teacher. And they were on the front lines. That sort of, I think, impacted me in ways I didn't understand till many, many years later.
Right.
And growing up as in the South, as segregation is falling, legal segregation began to fall. First year I went to school, it was the second year the schools in my neighborhood were integrated. We had to walk from our neighborhood, which was all African-American, across a ditch to go into another neighborhood about 2 to 3 blocks to go to the newly integrated school, which had previously been an all-white school. And, you know, when we were little, man, kindergarten, first grade, we'd come out the gate, man, and some days we got chased home, chased out of the neighborhood. And, you know, when that's
looks like we got a little lag here.
You kind of don't put it in focus. You do, but you don't.
Right.
You wonder, you know, why, but the passion for justice and the passion to work for the betterment of people and humanity has been sort of drilled into my veins, drilled into my DNA, and being on the cutting edge of a time of change in the South, I think really has influenced who I am and what I wanted to do with my life. And I got a chance to go to incredible schools, right? The best schools in New Orleans, the Ivy League, a top 10 law school, all of that. But that had to do with the fact that I had parents who wanted us to go where they couldn't go, to do what they couldn't do, to walk through doors that they had fought to open. It was truly, you know, motivational. But notwithstanding all of that, you know, very early on after I finished law school, you know, I realized, you know, I want to work, you know, for the betterment, for the common good. I want to work for justice and passion and use whatever I have to do that kind of work.
Right. That's what's up, man. And I applaud you for the work that you've done, because you are one of the few that truly have carried the civil rights movement into the 21st century. I'll say here, I was going to go into on this next question, the stats and the numbers we're seeing and the amount of, you know, Black and brown people that are dying. But I got to tell you, I decided not to say the numbers. And I'll say it because I am tired of hearing this every other day, them going up, and we are a significant amount of people that are dying. So my question to you is, why do you think that Black and brown people are being so affected right now?
You know, it's to me, to those of us that work on the issues I work on, it's obvious in the sense that it is a function of the legacy of slavery, segregation, and racial exclusion in the country. And we live in the 21st century. This is 2020.
Yeah.
And in the moment, we can look at things and say, things have changed, and things are better and they're greater opportunities. But what we've got to really internalize is that from 1619 all the way to 1964, segregation or slavery essentially was legal, sanctioned, and promoted in this country. That's a 150-year fundamentally horizon.
Yeah.
And so now, 50 years after the modern civil rights, there are legacies and there are left over, there are problems. And then even though the law changed, you've had people who fight every day. Look at this voter suppression business going on, right?
Mm-hmm.
And people fighting to make it harder for people to vote.
Yeah.
Voter ID, close the polling place, take your name off the polls because you haven't voted in 2 years. All sorts of, there's no purpose other than we're trying to keep the vote down, so some of us can continue to maintain power. And that's the legacy. So while legal segregation is gone, there's still a movement in this country which resists the march to equality, the march to fairness. There's a cadre, and we see it play out in the political sphere is where it's maybe most visible, but there are all sorts of things. Yesterday, I just haven't looked at the video of the young man who was beat up by some police officers, and another young man who was killed, vigilante style, down in Georgia. And then they said, well, they had a right to make a citizen's arrest. We're still dealing with those legacies. What I hope is that we have the, courage, will, fight. We have to fight intelligently. We have to do our work intelligently. If you just operate from a place of anger, outrage, and disorganization, right? You'll never win any battles. And that's what the legacy of people like Thurgood Marshall and Martin Luther King or Malcolm X or any of the frontline leaders worked intelligently. These mostly guys, but they were women like Fannie Lou Hamer and Ella Baker and Mary McLeod Bethune, who were part of the movement too. Anytime you saw them, they were well dressed.
Yep.
They had their arguments coherent. They had their facts together. They had their sense of outrage channeled. And why should we look to them? And we should look to them because they won victories.
Yeah, sure.
They won victories. They moved the needle in their time. And for our generation, it's about, will we move the needle or will we leave a legacy of backwardness where the progress we made goes backward? And now this COVID is just nothing. This is nothing new. It's just that all of a sudden the spotlight is on health disparities.
Yes,
I cannot tell you, brother, how many panel discussions, symposiums, research papers, statistical reviews, conversations I've been in over the last 25 or 30 years about health disparities. I have a sister who's a physician, and she every conversation that we have had since she's been a physician, which is over 30 years, is about the health disparities, and we have to do something about health disparities. And these problems are going to kill our community. And she's always telling me, you need to do something about it. You need to make noise about it. You need to make that one of your most. She's giving me advice, but she's saying, so now COVID comes. Now let me say this: in China, which is not ethnically diverse, somewhat ethnically homogenous, somewhat. There are different ethnic groups within the Chinese culture or Chinese people. But over there, the people who were dying were people with pre-existing conditions.
Yes. Yep.
Pre-existing conditions. And they were people with hypertension, diabetes, smokers, COPD, asthma, emphysema. I mean, the warning signs were everywhere. In this country, hypertension, diabetes, those are problems of all people,
Yep.
disproportionately Black and brown people.
Yes, of course. Right.
So we have to be motivated to act. We have to be motivated to repair these problems and do what we can on our watch.
Yeah. So such a valid point. I'll ask this then. Cities are slowly starting to open up now, right? You were a mayor, so you understand probably a lot more detail how a lot of this would actually go and take place. I can't help but think to myself when I see places like Georgia or cities that are predominantly Black open up first. I mean, am I wrong for thinking like?
No, you let me tell you, the governor of Georgia was careless and, in my view, somewhat irresponsible in that he opened up with really no plan. Mm-hmm. He didn't follow the guidelines promulgated by the Centers for Disease Control, which I might add are headquartered in Atlanta. Wow. He didn't follow that. He just said, let's reopen. To such an extent, even Trump, civil rights leaders, African-American religious leaders, we called him out and called out the states who did that. But even Trump called him out. Yeah. And now the question is, what's happening with the rate of infections? Look, there's a tension here because we've got 30 million people unemployed.
Yes.
We have people fearful that they're going to be evicted, people who are fearful that they're going to lose their homes. We've got children who have not been able to attend classes. We've got college students who won't have a graduation. We've got another incoming class of students not knowing whether they're going to be able to go to school. This is an unprecedented, so the tension is so significant. So it's not an easy call for a governor or a mayor to say, when do you reopen? What conditions need to be there? And that's kind of the call, you know, and I think the governor of New York is sort of probably best stated, articulated, and explained. Yep. Hey, look, we can open when these conditions are present, right? Yep. Something we understand. Hospitalizations have been going down for 14 straight days. There's sufficient testing. There's sufficient masks. There's sufficient medicine to treat people who, in fact, may get infected. And ultimately, though, I will say this. Ultimately, it's going to take a vaccine that we can vaccinate everyone, and thereby prevent the spread of this disease.
But even when that vaccine comes out, let's speak candidly here, right? Who are going to be the first ones to get it, and who are going to be the last?
Well, let me tell you what we have to demand. Right. We have to demand that the vaccine is free, and we have to demand that there's a universal vaccine program that doesn't treat anybody in preference.
Yes.
And that's why you need the kind of presidential leadership that we can trust, because it's only at that level who can say, this is the method. Look, I remember as a child, I don't know if I was a year or two old, but I remembered because I remember standing out in the sun outside of an elementary school to get vaccinated for polio. Mm. There was there's a massive vaccination program in the United States. And I don't know if we were first, last, or in the middle. I just remember standing in a very, very long line, and you went by and bam, they stuck your arm, bam. You went down, bam, they stuck your arm, bam. And they were vaccinating everyone. We're going to need a universal vaccine program, and they're going to have to use community-based sites. They're going to have to make sure that everyone can get this vaccine on an equal basis, and it is not any preference, and there's not going to be a caste system where some get it because they can afford it and go to a doctor, and others have to wait. And I hope that the powers that be at the Centers for Disease Control, et cetera, are working on what that would look like if you had to vaccinate 300 million plus people, right? Here in the United States. Yeah. And they ought to be working on that, because there will be, I'm confident there's going to be a vaccine. The question is when. When. Yeah. Right? The question is, when will there be a safe, effective vaccine? Until that happens, people are fearful. People are afraid to travel. Some people are afraid to go out their houses. Some people have a lot of health conditions. And, I'm worried about my mother. I'm worried about the other, more seasoned citizens in my family, friends that might have conditions. We're all worried and concerned because, the death against COVID, the death from COVID can be so sudden.
Yeah. Well, that's a valid point too, because I think we're all concerned, but then we could be at home like this for another year, a year and a half, right? So the point here is that people like you and myself are fortunate in that we can
We're
actually log
fortunate.
in and we can work from home. But then I have family members as too who have to be out there every day. People who are forced to be out there. And I say forced in terms of I have to pay my bills, right? And I have to do this. So now I'm putting my life on the line and I'm putting my family's life on the line. So in terms of how we start to reemerge or kind of come back into society, how would you recommend that Black Americans actually approach that, right?
Well, I think that Black Americans, so there's what our principles and standards are, and then there's always going to be this reality check that we got to deal with. So, our principles and standards are to demand that if we return to any workplace, that they've taken the steps to ensure that it's safe as can be, as clean as can be, that they implement systems and rules to ensure that people are not going to be infected. So they may have to be distancing if you work in an office. They may have to be staggered work hours or a platooning of people. There may be the necessity of wearing masks if you work in an office. There may be the necessity of not having more than 3 people in a conference room, that there's got to be some physical distancing. And the mask may need to be provided for by the employer, right? They may need to be thermometers on site,
right?
So that we can detect and we can we can detect in order to prevent. So there's a series of steps. So I think Black Americans have to be educate ourselves on the standards that the Centers for Disease Control have outlined for any sorts of reopening or return, and then demand that your mayor, your governor, your county executive follow those guidelines. But then the reality check is you could be put in a tough spot where you have an employer that says, if you don't come back, your job is gone. So if you don't come back. And there's a question as to whether, depending on the state, whether the laws will protect you. There is an open question. Some of my colleagues at the Legal Defense Fund and the Lawyers Committee for Civil Rights are looking at this question, and they've said, look, depends on the state, how much protection you are afforded. And so what I hope is that to the extent that they can, that employers are going to show some compassion, some understanding, that they're going to show some concern. And I think there will be those who will, and there are going to be those who won't.
I completely agree with you. And you hit on something that I was actually going to ask you next. And so that segues really well. And correct me if I'm wrong. Now, clearly states have not been set up to pay this many people unemployment, right? So that time comes, like you said, where they say, okay, we're open for business. Your employer says you have to come in. The minute you turn around and say, well, I can't, right? Then, correct me if I'm wrong, but can the state then say, okay, we're cutting off your unemployment?
Usually, the way unemployment historically worked is that the amount you get from unemployment is less than what you get if you work.
Right.
So the idea is to create some sort of an incentive. In this instance, I think what's more likely to happen is that there are those who will want to return to work and their job will not be there. Yeah. There may be an employer who said, let's use a restaurant as an example. I had 50 employees because I had 1,000 people in here every day. Now I'm getting 350 employees. I just can't hire 50 people. I can only hire 15 back. So then that 35 people who are not rehired either have to collect unemployment or find new work. That's a likely scenario here, right?
Yeah.
I think it's maybe less likely. I mean, on the margin, you know, if you have a person who says, look, I'm high risk, and because I'm high risk, I can't come back.
Okay.
I have diabetes, I have hypertension, but I also say to people, this means all of us have to have a philosophy of self-care.
Yes, absolutely.
If self-care,
absolutely,
which to me is self-love, self-care, self-love, hey, you have some conditions, get them addressed. If you have health insurance, go address them. Go to a physician, get a plan, get medicine, get a treatment regime. This is where we have to take, those who can, take matters to some extent into our own hands, right? Yeah. And I really encourage people to think of this as self-care, self-love. If you have underlying conditions, can you get them addressed? Is what's so important, because I think it's what's more possible is, and you know, I've just surveyed my own workforce, and some people say, well, because of my condition, I am hesitant to want to come back. Mm-hmm. And as an employer, I've got to think through, how do I accommodate that? You know, how do I deal with that in a fair and a responsible way, given the magnitude of this? Because look, we had, just in the last 48 hours, we had the spouse of one of my teammates, one of my employees, die suddenly. We don't know if it's COVID, but died suddenly.
Sorry to hear.
And then this morning, we found out that the building manager, who was extremely popular, great customer servant at our building, one of the building managers, passed also suddenly. Mm. So this thing starts to, bam, hit close to home. Bam, hit people you know. Bam, hit people you love. And then it's no longer, let me see what the stats are on TV.
Yeah.
Let me see what the numbers are on the internet, or when I read the paper. It becomes people I know, people I care for, people I love, who are now suffering because they've lost a loved one.
Yeah, absolutely, absolutely. So I'll ask you, do you feel that the disparities in the care, right, that we're getting right now, is going to shine a better light into the you know, getting help for Black Americans to get better health care, like in terms of policies, let's just say, right? In other words, like Dr. Clyde Yancey had actually said in his recent paper, is this that bellwether event?
If we demand it, and if we recognize that policies are made by politicians. See, the words are the same. Policies are made by politicians.
Right.
And politicians get their job
by the
through
people.
Elections.
Yes. Yes.
So 1, 2, 3.
Yeah.
You have to elect people you have to vote for people who are aligned with you, or best aligned with you. And we have to get out of this it doesn't matter mindset, which is an attitude to me of defeatism and surrender. I surrender. I'm defeated. We're defeated. It doesn't matter. And we just kind of rock along. And I feel very strongly that we need to understand, yes, look, Barack Obama got the Affordable Care Act through.
Yep.
Now, it was modest. It wasn't a radical thing in terms of what it did. It was modest in what it did. But man, these folks fought it.
Yes. Yes, they did.
They fought it. I mean, fought it in the Congress, fought it in the Court of Public Opinion, created an organization called the Tea Party, beat it up, sued it, challenged it in court. Now another challenge in court is currently underway. I mean, they whipped it, but it stood. And it moved the needle farther on healthcare than the needle had moved in a long time. But it didn't complete the deal. Yeah. It didn't do everything that needs to be done. How did it deal with disparities? It narrowed the disparities in terms of access to some extent by maybe a point, 2 points, 3 points, but it hadn't been narrowed in generations. So what that shows is the effort to provide, real health care to all, and also to change the system. See, the system has to change from a system which is designed to administer to the sick,
right,
to a system that's designed to promote wellness on the front end. And it requires mindset changes, that the doctor is not simply someone I go to see because I'm sick. The doctor is someone, it starts with having insurance and having access and having a doctor. There's a lot of issues, but it starts, and we have to educate and then create access and create. We need more doctors. Look, number of Black male doctors is going down in America. Number of African-American doctors is going down in America. We need doctors. We need nurses. We need nursing assistants. We need psychiatric aides. We need surgical technicians. We need physician's assistants. I mean, all these, and these jobs in healthcare pay relatively good money, not in every instance, but so we need a generation that says that, this pandemic is a wake-up call to health disparities. Health disparities are about quality of life. Health disparities are about our survival. And we can't say pandemic's over, rock, roll, get right back into the same old deal.
Yeah.
Right? We have to change. I shared with a member of Congress yesterday, member of the United States Senate, conversation I had. I said, look, you all are investing billions of dollars in the hospital system. Is that money going to be invested to create a hospital system that is tooled and retooled to help address health disparities, right? This is not just about building or putting Humpty Dumpty back on the wall the same way Humpty Dumpty was, or Humpty and Mary. Here, Humpty and Mary Dumpty. We have to build them back in a different way, in a better way.
Yeah, absolutely. So I'll ask this then, and I just want to say this for all the viewers that are out there right now. In a few minutes, we're going to actually open up for Q&A for another 10 or 15 minutes. So down on the bottom, you'll see the comments bar. To the right of that, you'll see a little box with a question mark in it. Go in there, ask a question, and then it'll come into my queue, and I'll ask them of Marc. That being said, Marc, how can Black Americans right now best mobilize themselves, right, and their communities to emerge from this and be more prepared for what everyone is saying is going to be a second wave, right? Because there is talk now that October, November is going to come out. And I got to assume that it starts to get hot, June, July, August, everyone's going to get outside. They're going to be doing this and that and the third and be ill-prepared for when this thing hits again. So how do we mobilize ourselves and kind of prepare for that?
First of all, we all have to do everything we can to build up our immune system. Build your immune system. My doctor, I'm not a doctor. I'm not giving medical advice here. Yeah. I'll just tell you what my doctor said. You should enhance the dosages of vitamin C, vitamin D, and zinc to help build your immune system, which is one thing, that we can all do. And I urge people to consult their doctors, study, and figure out how can we rebuild our immune system, because some people who've gotten it shake it off fast. Yeah. Some people who've gotten it end up on a ventilator. Yeah. And some people end up losing their lives, right? It's had a differential effect, on people. Secondly, I think we've got to demand that testing is available on demand. Yes. Anyone that feels that they need to be tested because they have a symptom should have access to that test. There shouldn't be any rationing. And then secondly, there needs to be access to not only the test to determine if you have it, but the other tests that helps you determine whether you had it already. Yep. And then there's got to be, as sometimes uncomfortable as it is, the face coverings and the mask may be necessary when we go out. Yeah. And I'll leave that recommendation up to the experts, but You know, we want to be safe. Look, I miss hanging out with my family.
Yeah.
And friends.
Yeah.
I have an 18-year-old who's graduating from high school this year.
Yeah.
I mean,
Tough.
it makes me sick that these high school seniors lost their proms and they'll lose their graduation ceremonies. I have an 8th grader who's going to be promoted to high school, and there's a beautiful ceremony that they have at the school every year for her. And will that happen? I mean, this, you know, and I'm using my own, but for all children, it just really, you know, these special times, the impact on children. So we have, in preparing ourselves, right? And then I cannot leave this out. We have got to vote in this fall's election.
Yes, we do. Absolutely.
And you've got to, right now's the time to register, check your registration. Make sure everyone in your home, everyone in your family is registered. We've got to vote.
We do.
Black America, you have got to show up at the polls in record numbers.
Yes, we do.
We have to vote for the vision that we have for our communities and our nation. We have to vote, and we have to be counted in the census. You know, there's a couple of civic engagement steps that I really want us all to take. I want us all to take the civic engagement step of being counted and voting in the election. You know, and you know, we could get into 100 reasons why right now, if it ain't obvious, I'm not feeling you.
Yeah. Absolutely, man. Absolutely. So I'm going to go into a couple questions here in the Q&A.
Yeah, let's do it.
One came in from Gene to Get Free. What is the Urban League doing to help with this crisis? I know you guys are doing a significant amount.
A wide range of things.
Yeah.
So in half a dozen cities, we are feeding people. We are providing grocery giveaways across the nation. In a number of communities, we are testing sites for people who want to be tested.
Right.
In other communities, we've provided virtual career fairs for people who are looking to connect to work. In other communities, we continue to work to ensure that people are counted in the census, even though the COVID crisis has kept many of us at home. And we are advocating, as we advocated, for investments that hit the communities, that hit the urban communities and the Black and brown communities. So we were very vocal that this small business paycheck protection program, round one, was executed in a clumsy way so that many of the people that got the money were larger businesses and publicly traded businesses. And we worked with a number of people on round two, and a special thanks to people like Maxine Waters, Nydia Velasquez, Karen Bass, Pelosi, Schumer, a number of others who heard us say, put more controls on number two. And then the banks, you know, we told many of the banks we were not satisfied with the way you all ran this program on round one. Give prioritization, and so to smaller businesses, to give priority, help ensure that African American and Latino owned businesses have a place in line, and they'll get pushed to the back of the line. And so we don't know as we speak whether round two's results are going to be better than round one's result. Right. I certainly hope so. So the Urban League has been an advocate for equity in COVID relief, as well as an actor in local communities providing direct services to people related to their sustainability and their health and their vitality. And we're continuing to do that. Right now, we are working on plans when it comes to workforce and connecting people to jobs, because we know with 30 million unemployed people, there's going to need help. We're looking at our housing programs, how we can expand what they do, because people are going to need help staying in their homes, keeping their mortgages intact, and avoiding eviction. So there's in some places there bans on foreclosures, bans on evictions. Those are not going to last forever. People are going to need help renegotiating, identifying resources. That's the work we do in communities across the nation. So right now, we're doing everything we've customarily doing, but my plan is how can we expand that work? And so for those of you who may be listening today, go to NUL.org. There are 90 Urban League affiliates. There may be one in your neighborhood, one in your community. We're there to assist families who are working on this challenge.
Right. That's great. That's fantastic. Here's another question that's actually coming in here. In order to fight more intelligently, what can African Americans do to promote an equality agenda in the 2020 elections?
That's an important question. So I think it goes beyond voting, right? When you want to be a promoter of an agenda, I think we've got to be much more engaged in the conversation with candidates. Yeah. And that means participating in town halls. That means sending emails. That means writing and applying pressure. I would point people's attention to the National Urban League's Main Street Marshall Plan, which is available online as an example of an agenda that could benefit the community that is already on paper. I would note that yesterday or the day before, presidential candidate Biden released, quote, a Black agenda, his agenda for Black America. I've not had an opportunity to look closely at it. I do know that we've advocated for the Main Street Marshall Plan to be included in his plan and everyone else's plan. And I understand that many features of it were included. So the important thing is, let's talk about what we need when we talk about equity. Yep. We need voting rights. We need criminal justice reform. We need a fairer shake on participation in the economy. We need opportunities for African-American businesses. We need support for historically Black colleges and universities and Black students that may go to mainstream institutions also. Yep. There are a number of things that we need to fight for, we need to push for, we need to work for. And I think people have to get involved. We have to get involved to a greater extent, to a greater degree.
Absolutely, absolutely. And here's the last question coming through before we close out. There's a lot to be dismayed by when you look at what's happening, as well as the statistics on COVID-19. But what are you, what is this? I think it's Holmes. But what are you mainly, it didn't come through, but what are you mainly hopeful about?
Let me tell you what motivates me. Okay. My parents grew up in segregation.
Yep.
They went to segregated schools. They rode behind the screen on the bus. They had to drink from separate water fountains. My mother tells the story of riding on the back of the train when she went to school later on in Boston, went to college in Boston. I look at it this way. We have to recognize that, is COVID a challenge? It is a challenge. Are health disparities a challenge? Yes. Are the times in which we face a challenge? Yes. But I don't know if it's as great a challenge as Harriet Tubman faced.
Yeah.
Or Frederick Douglass faced. Or the generation of our parents and grandparents faced. And so whenever I find myself maybe getting a little frustrated or a little cynical, I say, you know what? I ain't got no time for that because of what they had to endure and what they had to deal with and the indignities and the disrespect and they kept the faith and they fought in their fight. And so, what we may be fighting for now is not for today, but for tomorrow.
Yeah.
And we have to recognize that there's a fight. There's a lot of challenges in the United States, but I still think the United States is a nation of promise, a nation whose future can be better than its past. And I say that having traveled the world, you know, having studied, having seen, having talked. That doesn't mean it's perfection, but we got to fight, right? We got to fight intelligently and work for a just nation and the strength of our communities.
Absolutely. Absolutely. You said a lot today. Like you said a lot of
Hey,
stuff.
man, appreciate you, man. We
No,
had a good chat.
indeed. And what I took so much from this, but the things that stood out for me the most is number one is self-care, right? Like we can do better. And sometimes, you know, we need to take that step right forward. And it's important for us all to know that like like in order to create change, we have to actually take action, right? To your point, it's like going out and voting. And like you said, it's not just presidential elections. It's voting for your own, within your own neighborhood, right? Your local folks. And doing simple things like exercising, right? And eating
Yes.
healthier, making better choices when you eat. It's like instead of frying something, baking something. These are things that there's a lot that we can't control, right? But there are a good handful of things that we can control to make sure that we can actually get to the other side of this. And I'll just say, if there's one last thing you'd like to leave the viewers here with, please feel free. Open
I
mic.
mean, I'd like to just encourage the viewers to follow me, follow us on Facebook and on Facebook, Twitter, and Instagram. On Twitter, it's at Nat Urban League. I'd also like to let everyone know that I just wrote a book called The Gumbo Coalition.
I saw that.
Check it out. You can buy it online, and it talks about leadership lessons, and it talks about many of the things we've talked about today. You know, in terms of how to be strong, how to have a plan, how to be resolute, how to innovate. So I'd encourage people to do that. And what I just want to do is say, I'm going to end with lots of respect for healthcare workers and essential workers.
Absolutely.
Lots of respect for those that are getting up every day and they have to go to work. They must go to work. And so let's keep our prayers around them, and let's keep our prayers around all those folks who met their maker and who've lost their lives. We got to be strong together. We got to join together. We can join together to fight and get through this, and we will.
Love that. I love that. Marc, first of all, hopefully I can get a signed copy of that book from you.
You got it, man. Just make sure I got you. In order to get a signed copy, I need a mailing address.
Yes.
All I need is you get me a mailing address and I'll get your book.
I will send it your way, and I appreciate your time. And it's so important that voices like yours are heard. We are going to do the best that we can to actually promote this and get this out to as many people, because this is important. We all need to do better, and we all need to make a lot more noise, I'll say, so we can be heard and take some more action. So thank you, brother. I appreciate your time. Thank you for joining us today.
Yeah, stay safe, stay healthy. Thank you.
Have a great one. Take care, Marc.
Thank you.